Hi, Niso.
Hi, how are you?
I'm okay. How are you doing?
I'm doing good, thank you.
I'm Dr. Matt. I'm going to do your examination today. Can you please verify your last name and your date of birth?
Yeah, it's ASMR,
Mm-hmm.
and date of birth is October 28th, 1996.
Okay. And do you have any allergies?
I do to like pollen, and I have a little bit of a gluten allergy.
But no allergy to medications, correct?
No, not that I know of.
Okay. And are you taking any medicine on a daily basis?
I am, so I usually have to take a lot of Advil or Tylenol for pain. I get a lot of headaches.
Okay.
And it's been getting worse in the past few weeks, I would say. But I've had trouble with getting migraines my whole life, pretty much.
Okay. And on a scale of 0 to 10, how bad are they when you do have migraines?
I would say they're closer to, like, on a good day, 7 to 8.
Okay.
It's pretty bad.
And is it radiating towards one part of the head?
On my right side, more than anything. Just like, it goes, like, the pain is in my eye sometimes and in the back of my head.
Okay. So face with eye and the back of the head.
Yeah.
All right. Any other symptoms that come and go, or?
Yeah, so with my hands and my feet, I can feel kind of like pins and needles type of feeling. It's really uncomfortable, but I do feel it. So I don't know if it has anything to do with that.
Okay. Is that constant, or do they come and go?
It depends on if I am getting heavier migraines. It's typically constant.
Do you feel that there is a relation between migraines and the pins and needles?
For sure.
Okay. Any head injuries?
Not that I can recall. I mean, I've definitely hit my head before, but I don't remember getting like concussions or anything.
Okay. All right. I'm gonna go ahead and take your vital signs. Okay, and have you noticed any difficulty seeing? Vision changes?
I do have a hard time seeing from my right side, but that's just kind of like been a thing. But I wouldn't say anything
So you
changes.
kind of like got used to it, but
Yeah.
that's definitely not normal. So we're gonna go ahead and check that as well. I'll put this on your index finger. And this will go on your forehead. I'm gonna have you uncross your legs for me, okay? Okay. Blood pressure is 121/60. Okay, and heart rate 64, oxygenation 97. Okay, Romare. Blood pressure was said it was really good, 121/60. And I'm going to listen to your heart and lungs. Is that okay?
Mm-hmm.
Is it okay if I slide the stethoscope under their shirt?
Yeah.
On the left side. Okay, you can go ahead and breathe normal. Okay, go ahead and take a deep breath in and breathe out. Very good. And again, take a deep breath in and breathe out. Okay. I'm going to check your pulses. And I'm going to compare them. Okay. Okay, I'm going to check your vision now. Go ahead and look straight at my nose. And I'm going to flash a light in your eyes. We're looking for pupil dilation and constriction. Very good. I'm going to lower the lid. And just there. Looks good. Alright, without moving your head, I'm going to have you follow the light with your eyes only. Okay, so you can move your eyes pretty normal. I'm not seeing any rhythmic changes. What I'm going to do now is I'll bring the pen light very close to your nose. I'm going to have you focus on the pen light, okay? It's going to become a little bit uncomfortable, but trust me. Okay. And one more time. Okay, very good. I'm going to check your ocular nerve. So for this, I'm going to have you look behind me straight at the wall, and I'm going to come very close to your eyes and take a look inside. Okay, and you did say that your right eye is causing you problems. Okay. I was not able to see anything abnormal there. What I'm going to have you do, I'll have you keep your head straight and not move your head towards me. Sorry. Perfect. Just like that. And what I'm going to do is I will bring my fingers out of your field of vision. I'm going to need you to tell me when you don't see them anymore, okay?
I don't see them, no.
Okay.
I don't see them. I don't see them. I don't see them, no.
Okay. I'll go ahead and cover your right eye. And tell me when you don't see when you see my fingers in your field of vision, okay?
I see it now. I see it now. I see it now. I see it.
Okay. Let's go ahead and switch eyes.
I see it now. I see it now. Now I see it. Right here.
Okay. All right, I'm going to have you cover one eye. And go ahead with your left hand, grasp this chart. Yes. And I'll have you extend your arm all the way. Perfect. Can you please tell me what color this is?
Red.
And can you read these letters?
LTFPH.
Okay. Go ahead and switch eyes. And can you tell me what color this is?
Green.
And can you read this row starting with the first letter to the right?
I actually cannot see anything.
Okay.
Yeah.
All right. I'm going to check your mouth, see see if there's anything abnormal there. So first, I'm going to press down with this tongue depressor, and I'm going to need to say ah. Okay. Say ah.
Ah.
Okay, very good. We're gonna go ahead and do a taste test. So I'm going to put this paper on your tongue, and I'm just gonna need you to taste it. Go ahead and close. And tell me what that tastes like.
I would say it tastes like bread.
Okay.
Like wheaty type of flavor.
Okay. And I have here one more.
That one tastes like oranges.
Okay. Okay, I'm gonna have you look up. We're gonna check your nose. Okay, I'm not seeing any redness there. Good. Have you noticed any changes with your sense of smell?
Not necessarily, no.
Okay, so I'm gonna go ahead and have you take a deep breath into your nose and tell me what that
It smells like lavender, but I'm not sure.
Okay. Go ahead and try this also.
Garlic?
Okay, very good. Okay, I'm gonna go ahead and check your facial sensations now. I'm going to touch you with two objects. One is going to feel dull. This is what dull is going to feel like. And the other one is going to feel sharp. This is what sharp is going to feel like. Go ahead and close your eyes and tell me if you feel sharp or dull.
Dull. Sharp. Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp. 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 Dull. 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 Dull.
Okay, go ahead and tell me if you feel this dull on both sides equally.
Yes. Yes. Yes.
Okay. And I'm going to check your reflexes too. Go ahead and relax your jaw. Relax. Good. Okay. Alright. Do you feel this equally on both sides, left and right?
I feel it a little less on the right.
Okay. Tell me when the vibration stops.
Stopped. Stopped.
Okay. I'm gonna go ahead and take a look at your hands now. So go ahead and relax. I'm gonna have you squeeze my fingers first. Okay, a little bit harder. Okay, that was pretty equal. I'm gonna ask you to wrap your fingers around my fingers and squeeze. Okay, same thing on the other side. Okay, and I'm gonna ask you to spread your fingers just like that. Perfect. And I'm gonna try to close them. Don't let me do that. Okay. Okay. Okay, now go ahead and you can keep your fingers together. What I'm gonna do is I'll try to push them down. Don't let me do that. Okay, I'm gonna try to push them up. Don't let me do that. Okay, I'm gonna try to open your arms out. Don't let me do that. And I'm gonna try to close them. Okay, very good. So I'm gonna go ahead and do a series of tests for sensorial examination. All right, go ahead and put your palms up like that. Perfect. Yes, thank you. And what I'm gonna do is I'll touch you with two textures. Go ahead and close your eyes. One is going to feel sharp. This is what sharp is going to feel like, and the other one is going to be dull. This is what dull is going to be. Go ahead and tell me if you feel this sharp or dull. We're going to focus on the tip of your fingers. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Dull. Okay. Can you please tell me if this feels cold or warm? Cold. Cold. Warm. Cold. Cold. It's cold. Warm. Okay, and go ahead and tell me if you feel 2 points touching or 1. Okay. 2. 2. 1. 1. 2. 2. 2. 1. 1. 1. 1. 2. 2. 2. 1. Okay. Just going to go ahead and check for any neurological presence of any abnormal reflexes. Okay, very good. Good. Go ahead and close your eyes. All right, so what I'm gonna do is I will place an object in one hand. I'm gonna need you to tell me if you can identify the object. These are car keys. Okay, good. And you can feel free to use both hands if you need any extra sensorial stimulation. Sunglasses or just glasses? Okay. And now I'm going to put 2 shapes. I'm gonna need you to tell me what kind of shape this is. A square. Good. And this is a triangle. All right. And would you be able to tell me which one is bigger? The square. Okay. All right. Very good. So we're gonna go ahead and do a foot examination as well. I'm gonna have you lay down. Okay. Okay. So you're saying that you're feeling pins and needles. Is it in the certain, like a specific toe or?
No, just the soles of my feet overall.
Over here?
Yeah.
Okay. Right, beat-up pulses are 2+, so overall, I would say normal peripheral circulation, normal temperature. I'm gonna have you, so let's go ahead and focus on the left leg first. I'm gonna have you spread your toes as much as you can. Okay? What I'm gonna do is I'll try to close them. Don't let me do that. Good. Okay. All right. Go ahead and relax. So now go ahead and wrap your toes around my finger. Okay. What I'm going to do now is I'll try to push down the front part of your feet. I'm going to have you resist that. Okay. And now go ahead and push with the pads. All right. And with your heel. Push. Okay. I'm going to check your Babinski reflex. So it's going to feel kind of pointy. And we're looking for a certain movement. Okay. Let's go ahead and try that one more time. Okay. All right, good. Can you please tell me if this feels cold or warm?
Warm. Warm. Cold. Warm. 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 Cold. Cold. Warm. Warm.
Okay, are you feeling the pins and needles as we speak right now?
Yeah. Just kind of all over the sole.
Okay, I'm going to do another sensory examination. So go ahead and tell me if this feels sharp.
Yes.
Okay, and does this feel dull?
Yes.
Okay, sorry. I'm going to go ahead and touch you on the sole of your foot. Go ahead and tell me if you feel this sharp or dull.
Okay. Sharp. Sharp. Dull. Sharp. 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 Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. 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 Sharp.
Okay, and tell me if you feel this 2 or 1.
Okay. 2. 2. 1. 1. 2. 2. 1. 1. 1. 2. 2. 2. 1. 2. 2. 1.
Okay. We're gonna do the same thing on the other side. So go ahead and try to wrap your fingers around wrap your toes around my finger. Good. Perfect. So what I'm going to do now is I will push down on the front part of your foot. Go ahead and resist. Okay, good. And I'm going to have you push down now. Good. Go ahead and do the same thing with your heel. Good. Can you please tell me if this feels cold or warm?
Warm. Cold. Cold. Warm. 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 I can't tell that one. Cold. Warm. Warm.
And does this feel sharp?
No, it feels dull.
And does this feel sharp?
Yes.
Okay. Go ahead and tell me if this feels sharp or dull.
Dull. Sharp. 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 Dull. Sharp. 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 Dull. Sharp. 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 Dull. Dull. Sharp.
Okay, I'm going to check your Babinski reflex. Good. Go ahead and tell me if you feel this 2 or 1.
Okay. 2. 2. 1. 2. 2. 1. 2. 2. 2. 1. 2. 1.
Okay, I'm going to have you sit on the table and we're going to go ahead and discuss. Okay, Niso, we're going to go ahead and order a CT of the head. And I don't want you to be worried. I'm not worried. I just want to be extra careful and make sure that we're covering our bases and we know exactly what's going on. The assessment was not that bad. I was expecting a little bit worse than you when you described it, but I think it's gonna go away within time. You might have some pinched nerve that could cause that. So next time that you come in, we're gonna take a look at your back as well.
Okay.
All right, and I'm gonna have you take some medication for this. It's going to help with the nerve pain. It's 2 milligrams once a day. Okay, and I'll have you pick this up at the pharmacy.
Okay, thank you, Dr.
You're
Mann.
welcome.
Appreciate it.
No problem. I'll
Have
see
a
you
good
soon.
one.